Henry Ford Health. Today we welcome nurse practitioner Carl Wright and nurse practitioner Emily Ball. Welcome to the show.
Yeah, good to be here. Thanks.
Yeah, great to have you here. And Carl, you're also lead advanced practice provider over same-day care clinics in the Jackson region.
That's correct.
Nice. How long have you been at Henry Ford?
27 years.
27 years.
Oh,
Wow.
a long time, yeah.
That's awesome. So this is your whole career, right?
My whole career, pretty much, yep.
Awesome. How about you, Emily? How long have you been?
I've been with the organization since we opened our clinic in Chelsea a little over 3 years ago.
Cool.
Yeah.
Well, today we were going to talk about same-day care, and that might be an unusual term for our viewers. What does same-day care mean?
It means you can set up an appointment and get seen on the same day. It's similar to the walk-in clinics, but for a walk-in clinic, you would come in and check in, and there may be 10 people that signed up, and you would have to wait till you come up in the queue to get seen, whereas we have appointment time, so you would set an appointment at 11 o'clock and you'll be seen close to that time. It helps prevent the delay in getting or waiting to be seen.
Is there a particular reason someone should seek to have same-day care versus waiting for a regular appointment?
I mean, the regular appointment is going to take care of more of your chronic issues, but if a lot of chronic issues also have or can have an acute component. So maybe you always struggle with back pain, and then today you woke up and your back is really hurting. That would be more of like a same-day care appointment, but if you're just your normal back pain, just follow up, you just keep your appointment with your primary care provider.
If you show up at work and your coworker says, "Oh, gee, you'd better see a doctor."
That's good for
same-day care. Have you seen
care.
a doctor for that?
Yeah.
Get away from me. I think you need to see a doctor like today.
Yep.
Yeah. And I think people fear that if they don't want to make the appointment because they're going to have to wait a long time, and maybe the problem will clear up by then. Or
Sure.
Yeah. Same-day clinic is actually, same-day care is actually happening in a regular practice office, right?
Yes, at the North Street Clinic, we're actually right next to the primary care providers, and many of our patients are North Street patients. We do see other patients as well, but we are in the clinic with the primary care providers. Our East Michigan clinic is attached to the East Michigan primary care office, so they're right next door. And we're trying to start primary care in Chelsea also at that clinic. Right now it's only same day, but we're working on getting a provider there also.
And it's fairly new. It's taking off. You told me before the show.
Yeah, we're getting busier every day, every week, but still plenty of openings. But we do work, even though we don't have family medicine on site, we work pretty closely with some of the family practice offices that are outside of Jackson, like in Grass Lake and Brooklyn. Sometimes Leslie patients will come to us. The advantage for us is that we can then directly communicate with your primary care doctor. So they have an idea of what's going on, even though it's more acute.
Give me an idea of maybe a couple of reasons, health concerns that are best suited for same-day appointments.
Yeah.
So like a pink eye would be a good one,
Oh,
a cough or cold. Your kid wakes up with a fever. It's an unplanned event, so it's nice to have somebody that can see them today. Sometimes patients have a hard time getting into primary care. They might see them like next week for their fever today, so it is convenient. So ankle sprains, minor lacerations, headaches, urinary tract infections, those are all good things. And if you're ever uncertain whether or not you should go to the ER kind of thing, so if you had a cough with maybe chest pain, you could come to see us and we would be able to direct you. If we can't take care of you in our clinic, we'd be able to direct you to the ER.
And here are some of the reasons. And you'll never tell someone, "Oh, you're not sick enough to be here."
Never.
Oh, never. We also have X-ray at all of our sites, at all of same-day
diagnostic centers,
sites. Yeah.
X-ray and lab.
X-rays and lab.
So,
yeah.
And NPs, you're like doctors, really. You can prescribe, you can treat, you can do it all.
Yep.
Well, yeah, we can write medicines. We can, order X-rays, lab work.
Now, what if someone says, "I've never seen a Henry Ford doctor, I'm not on my chart, I'm not in the system"? Can they still come and use a same-day care provider?
For sure, we welcome everybody who wants to come in. For our Henry Ford patients, we are able to communicate a little more directly through our charting system, so we can send a copy of the chart to the Henry Ford patients, but we welcome everyone. So it is a nice service to offer for the patients, I think.
And then if they're not a Henry Ford patient, right, we can get them maybe set up with a primary care doctor, make some suggestions, and then if they need to be seen for other things that are not outside of primary care, we can make referrals within the Henry Ford system and outside the system too, but
Right.
usually within the
Yeah,
system.
maybe they'll want to be a Henry Ford
Maybe so.
patient. Why not? So are there other ways to access same-day care besides coming in person to one of your locations?
We don't do virtual visits for same-day care. Our primary care doctors do virtual visits though.
Okay.
And sometimes they can squeeze those in as the same day. But as the same day clinic, no, we do ask that you come in so that we can best evaluate you.
Okay, so the same-day visit is in person with a nurse practitioner, but a virtual visit is only available with a doctor?
Yeah, currently I think there are doctors out of Detroit, so you would talk on a Zoom call with them. The only ones I have seen have been through doctors. I don't know if that's entirely true, but our clinics have physician's assistants or nurse practitioners that will see you.
So someone, maybe they have primary care and they don't have the same service, they can't get in. Then, do you keep them in the loop, their primary provider?
Yeah, absolutely. We can always copy the chart and send it to them, especially if they use Epic. Henry Ford uses Epic, U of M uses Epic, IHA uses Epic. So the big players around here, so we can keep everybody on the same page and up to date with the information.
When someone has a health concern, I think they wonder, oh my gosh, should I go to the ER? Should I go to urgent care? Should I just call my regular doctor? Or should I go to some same-day care service? How does someone decide? I mean, is there any kind of hard and fast rules about it?
Well, we have a list of our of diagnoses that we do see. If there's ever a question, they could always call or set up an appointment. We do pre-screen our schedules, so if something seems inappropriate, like say they think they're having a heart attack on that schedule, we could call ahead to warn them that that's something that probably should be taken care of in the emergency room. So it's pretty simple for us because we do it all the time, but if ever anyone's not sure, you just give us a yell and we can kind of guide you as to what would be an appropriate place to be.
Yeah, same advice?
Yeah, definitely.
I will always go to the most severe place because I think I'm got the most worst thing that I can't wait for anyone else.
Yeah.
I just get me in
Yeah.
sometimes. But no, I get it. I mean, it's you really just have to make a common sense decision.
I think most people are pretty darn good at self-sorting.
Yeah.
Yeah, and deciding where they need to be. I would say that we can take care of the vast majority of things that come through our doors, but those really inappropriate things, your heavy hitters, heart attack, stroke, crushing headache, like brain aneurysm, we can't do that because we're not acute care enough.
I cut my arm off in a chainsaw accident, ER.
Yeah, for sure.
Yeah, 100%.
Yeah. So having same-day care, are we seeing an improvement in health outcomes and overall service in the community?
I think it's mostly access to care. Like I was saying earlier, sometimes it's very difficult to get into your primary care. So you may have your blood pressures running high and you can't get a hold of your doctor. So you have some questions about your medicine. So it'd be a good thing to come talk to us about that. Maybe we can help you adjust or maybe help get a message to your primary care provider to see what they want to do with that issue. Yeah.
A lot of our work comes down to keeping things that can be treated in the outpatient world, treated in the outpatient world, and things that need to be in the ER, in the ER. So we help family practice, really one of the goals is to keep people out of the ER when it's inappropriate, right? We want you to be seen in the ER when you need to be seen in the ER. But if it's not necessarily something that should be seen in the ER or something that could be taken care of in the outpatient world, in the same day clinic world, in the primary care world. We want to make sure that we're capturing all of those people, because it does help healthcare costs, especially, which is a big problem. And then it helps us get better follow-up with the people so that their issue gets resolved quickly and is treated appropriately over time, right? ER is really good at that time, but they're not very good at follow-up because that's not their purpose.
Right, you're on your way.
You're on your way, right.
All right, what's the one thing that you'd like viewers to know about Henry Ford's commitment to making care accessible when people need it the most?
I just want everyone to know that we're here for you. You know, we're open late until 7, 5 days a week, 7 or 8. The Chelsea Clinic's open till 8, and we are open on Saturdays. So do stop by, give us a call if you have questions. We'll help guide you, help get you taken care of until you can get into your primary care provider.
Awesome. Well, it's great to have you both here. Thanks for the great services and healthcare you provide the community.
All right. Thank you so much for having us.
Yeah.
Yeah, I think nurse practitioners are frontline heroes.
Oh, thanks.
Oh,
That's very kind of me to say. But
Yeah, very kind.
Two of Henry Ford Health's nurse practitioners, Carl Wright, who's nurse practitioner and lead advanced practice provider over the same day care clinics in Jackson region, and nurse practitioner Emily Ball today on Henry Ford Health presents Wellness Wednesday. The next